Hi guys, this is Dr. Laiba Fatma. Today we will be talking about heart murmurs. Today we'll only talk about mitral murmurs, mitral stenosis and mitral regurg. And I'll also talk about the high yield Uworld points at the end. So stay tuned and let's start it. Let's talk about what is mitral stenosis. Mitral stenosis is basically the stenosing of the valve or calcification or the narrowing of the mitral valve, which leads to obstruction of the blood flow from the left atrium to the left ventricle. So blood basically starts pooling into the left atrium. Why? Because there is not enough passage for the blood to pass from the left atrium into the left ventricle. Let's talk about the etiology or the causes of mitral stenosis. So the number one cause is rheumatic heart disease. I think you all may know that rheumatic heart disease is the chronic condition caused by acute rheumatic fever, which is basically caused by group A streptococcus, which leads to pharyngitis, and then the antigens cause the heart, act on the heart valves, and they cause rheumatic heart disease. I think this is a good basic knowledge of rheumatic heart disease. The second condition is age-related calcification. As you age, as you get older, everything basically in your body starts calcification. So if the valve has calcifications on it, the opening will become narrow, and this leads to mitral stenosis. And the last is radiation induced. If you have cancer of the lungs or breast cancer, and you will be exposed to radiations on your chest, so it can lead to calcification of your pericardium, pleura, and also the mitral valve. Now that we know the basic info of mitral stenosis, we have to know how it presents, because Uworld will not tell us directly that, oh, this patient has mitral stenosis. Uworld will just give us hints that how mitral stenosis will present. So the number one presenting feature is dyspnea. The patient will feel dyspneic because there is not enough blood supply which is going from the left ventricle to the body. So the patient will basically feel dyspnea. And another feature of dyspnea, another cause for dyspnea basically is that as the blood is not flowing forward into the left ventricle, so the blood is pulling back into the lungs, because where do the blood come in the left atrium? It comes from the lungs. So if the blood is not moving forward, it will go backwards into the lungs, and this will cause pulmonary edema, and it will lead to dyspnea because there is not enough oxygenation and there is not enough blood flowing from the left ventricle towards the body. The next is orthopnea. The cause for orthopnea is the same as for dyspnea. Basically, orthopnea is when you cannot breathe or there is shortness of breath when you lie flat. So why does it occur? Because when you lie flat, there is increased backflow of blood into the lungs, so it causes orthopnea. The next is paroxysmal nocturnal dyspnea. It basically means that when the patient lies flat for sleeping during the night, nocturnal, the blood flows back into the lungs and it causes dyspnea. So this is paroxysmal nocturnal dyspnea, and this is also a feature of left heart failure. And the Uworld will describe it as the patient needs to get propped up during sleeping, or the patient uses excessive 2 to 3 pillows when the patient has to sleep. Another symptom that the Uworld can give you is hemoptysis. So basically the pathophysiology of hemoptysis is as the pressure in the left atrium increases, it causes the backflow of blood into the lungs, as you can see in the diagram. So what does it cause? It causes increased backflow of blood into the lungs. It causes increased pressure in the lungs, which can lead to pulmonary hypertension. And when there is hypertension, there may be rupture of vessels. When there is rupture of vessels, so there will be blood in the lungs, and which will be expelled out through coughing. So hemoptysis is basically blood in the cough. And as you know, as the blood is not flowing into the left ventricle, it is pooling up in the left atrium, so the size of the left atrium increases, which can lead to Ortner syndrome. Ortner syndrome is basically that hoarseness develops because the left atrium compresses the recurrent laryngeal nerve, and which leads to hoarseness. So this is also a feature of mitral stenosis. And as the size of the left atrium increases, the circuit which causes the left atrium to contract simultaneously, it gets disrupted, because now the left atrium is very enlarged in size. So this can predispose to AFib, and AFib is a very important clinical correlation with mitral stenosis. So if the patients get AFib and you will ask what is the predisposing factor for AFib, the answer will be mitral stenosis. Let's talk about the findings on auscultation. The number one thing we'll discuss is the location, then we'll discuss if it is a diastolic or systolic murmur, then we'll describe the features of the murmur. So as you know, this is mitral stenosis, so it will be at the mitral area or the apex, and it is a diastolic murmur. It has an opening snap to it. Why? Because when the left atrium is contracting and the pressure is rising slowly, at one point the stenosed valve will click open, and all the blood from the atrium will go into the ventricle. So that point where the stenosed valve opens, that is the opening snap. The cause for mid-diastolic rumble is that because the mitral valve opens late when the pressure is adequate for its opening, when the opening snap occurs, and when the valve snaps open, so till then the systole has ended, but the blood flow will continue because at that point only the mitral valve has opened. So there will be mid-diastolic rumble, and for this specific cause there will be loud S1 also. Let's hear its murmur now. Focus on the opening snap. Treatment is not commonly asked in step 1, but you should know the basics. So we can do percutaneous valvotomy, we can repair the valve, or we have to do a proper open surgery to repair the valve and to remove the stenotic areas. So let's talk about mitral regurg now. Mitral regurg is basically the backward flow of blood from the left ventricle to the left aorta, left atrium, not the aorta. Why? Because the valve cannot close properly. In stenosis, the valve was stenosed and it could not open properly, and in mitral regurg, the valve cannot close properly. So when during systole, the left ventricle will contract, the blood, instead of going to the aorta, it will go back into the atrium. Let's talk about its causes now. The number 1 cause is ischemic heart disease, which leads to the dysfunction of the valve. The second cause is post-MI. Basically, the post-MI, the papillary muscles rupture. It is a post-mitral myocardial infarction change which occurs in the first 2 to 3 weeks or 1 to 2 weeks basically. So the papillary muscles rupture or the papillary muscles loosen, so which will cause the regurg, right? So it will lead to valve incompetency. If the left ventricle dilate due to any cause, like due to heart failure or due to any other cause, so the leaflets will get far away from each other and the valve cannot close properly. And the next is acute rheumatic fever. In acute rheumatic fever, it will lead to mitral regurg, and if the rheumatic fever turns into rheumatic heart disease, or the rheumatic fever continues chronically for more than 6 weeks or for indefinite period of time, the mitral regurg will convert into mitral stenosis. So mitral regurg is an immediate complication of acute rheumatic fever, and mitral stenosis is a late complication of acute rheumatic fever. Its presenting complaints are very simple: dyspnea, edema, and cardiogenic shock. Cardiogenic shock occurs because the blood cannot flow towards the body, and it leads to cardiogenic shock. Talking about its murmur, it will of course be at the mitral area, at the apex, because it is mitral regurg and it is a holosystolic murmur. During the systole, all the blood will flow back into the left atrium. Throughout the systole, we can hear this murmur. It will be a high-pitched blowing murmur because the blood flow will be flowing back into the left atrium, so it will be a blowing murmur. The blood will produce a blowing sound, then it will go back into the left atrium. And its radiation towards the axilla is very important. Let's hear the murmur now. As for its treatment, the only treatment we can offer is mitral valve replacement. So now let's talk about the high yield points which Uworld mentions. If the Uworld wants to mention mitral stenosis, it will definitely mention an opening snap, and it will definitely tell you that there is a mid-diastolic rumble or mid-diastolic murmur at the mitral area. And sometimes the Uworld does not say mitral area, it says the apex beat. At the apex beat, we can hear a mid-diastolic rumble or we can hear an opening snap. So this will be the key point in the question. And for mitral regurg, what the Uworld will tell you is that there is a holosystolic murmur at the apex, or Uworld also tells you that there is a murmur or there is an extra sound which we can hear in the axilla. So if you're hearing something in the axilla, that means that there is a murmur which is radiating towards the axilla. So the murmur is most commonly mitral regurg.